Welcome to Alpha Wolf Capital. I'm Tim, and I want to personally thank you for stopping by. This channel is designed to help small companies, both public and private, gain exposure with potential consumers, investors, even partners. Take, for example, today's guest, newly appointed CEO Arun Swaminathan with Coya Therapeutics. Coya Therapeutics is a clinical stage biotechnology company focused on developing proprietary new therapies to enhance the function of regulatory T cells. They are currently developing a multi-modality TREG therapies for neurodegenerative, autoimmune, and metabolic diseases. They have 4 diseases that they have targeted: ALS, dementia, which is personal to me, it's what I lost my father from, Parkinson's, and Alzheimer's. All of these are horrible diseases. And there is some real promise with the therapies that they are working on. But I'm going to let Arun tell you more about that in just a minute. This is not to be taken as investment advice. I am not a certified financial planner. This is for education and entertainment purposes only. I encourage everyone to do their own due diligence. Hey everybody, Tim from Alpha Wolf Capital coming at you with a follow-up to I think, under the radar story that is maybe underappreciated, but we're going to try and set some of that stuff, or at least paint a clearer, better picture of what's happening over at Coya Therapeutics, and that ticker symbol is COYA. Arun is here to give us an update on the exciting stuff that's happening in your world. Thanks for coming in, Arun.
Tim, thank you, and always a pleasure to talk to you. So I appreciate it.
All right, so you've had some interesting things develop, right? And you're on track with your study for ALS, right?
Yes.
So can you give us just a little update and share with us the things that you're excited about at this particular point in time?
Yeah, happy to, Tim. So first, I'll start with the ALS trial. Where obviously that's our priority. We remain excited about the potential for a transformative therapy for patients with ALS. We are fully on track. Everything is on track as we have guided in the past. We anticipate submitting all the required information to the FDA in the second quarter and starting the clinical trial later in this year. So that's pretty exciting. And as I think we have had in previous discussions, the unmet need in ALS is just so high. So we are pretty hopeful that we will find a way. Hopefully, we'll be the product that makes the first breakthrough for patients with ALS and gives them a chance. So we're pretty excited about that, and all the data supports it to date. That's what excites us. Other exciting things happening as well. I think you might have seen we recently announced some biomarker data on patients with Alzheimer's disease. So this was a follow-up to the results we had disclosed in November. I'll just keep it simple. What it told us was that we bring down inflammation at the cellular level. So that's a good thing. And all those different markers, I can get into the fancy markers, but I don't think that's important at this point. What the key takeaway from that study was, we are bringing down inflammation across the cellular level. Why does it matter is something people sometimes ask. It matters because it's real then. Because with the clinical data we had presented, people always say things like, hey, maybe patients just felt better and they reported they're feeling better. Maybe they felt that their memory is getting better. This takes away any of that subjectivity. What this shows is it's an objective measure. It says, look, this thing is not going to move because of some placebo effect or because people thought they're feeling better. This is real. And then when you match it with the clinical outcomes we saw, which is we stopped in that investigator-initiated trial, we saw a stop of decline in cognition by the ADAS-Cog score. It all starts to add up, and it's pretty exciting. That in alone, that was just with the low-dose interleukin-2. That is exciting because now we have also filed intellectual property, Tim, around the combination with these popular weight loss drugs, right? The GLP-1 agonists. I think by now, GLP-1s are a household name. I don't think I need to even explain what they are. What we have seen in preclinical work, and we'll share more of it in the upcoming months, is that when we combine these weight loss drugs, whether it's like, drugs like Wegovy, Ozempic, Zepbound, those types of drugs, with our Coya 301, they're synergistic, meaning 1 + 1 is better than 2 in these neurodegenerative markers and other diseases as well. Independently, GLP-1s are showing data that they have a positive effect on Alzheimer's disease. There was a study in Nature Medicine published like 3 weeks ago, if I'm right, that was studied in 1 million patients in the VA administrative system. Gist of it was, of 1 million patients studied, patients that took GLP-1 for their diabetes control had lower incidence of dementia or onset of dementia compared to the diabetic patients that took something else, like DPP-4 inhibitor or other mechanisms for diabetes. That is pretty powerful. And we had already thought about it. We had already thought about at Coya that, hey, we believe GLP-1s will have positive impact on Alzheimer's, but we also believe that it alone may not do the trick to treat Alzheimer's patients. Maybe it has a preventive potential, but then we had this idea that, combining that modality with ours makes a lot of scientific sense. So we've been studying it in the preclinical setting for a while now, and what we find is that the potential is real. So that is pretty exciting because that not only opens up a whole new option for patients with Alzheimer's disease, but also opens up a whole new untapped market potential for Coya as well. And I think that's going to be a kind of a hidden gem value driver that's sitting with us that I don't think we have, people are yet caught on to. But you asked me since the last conversation, what am I most excited about? I would say that is right there what I'm most excited about.
And I would say that would be an incredible thing to be excited about, because you're talking about having an impact on a disease that, for all intents, don't even know. We still don't understand exactly what causes dementia, what causes Alzheimer's, right? I mean, so if you can have an impact on that, I think that's huge, right?
100%. Yeah. Nobody fully understands what happens in these diseases. But Tim, we do know one thing. We do know that inflammation plays a big, big part. So addressing neuroinflammation at the early stages does matter, which is exactly what we do. And these combinations, if you think about our approach, we always say Coya 301, which is our proprietary low-dose interleukin-2, is kind of the backbone. We believe that combining it with other products, other mechanisms, is the way forward for many diseases. We did that with ALS, right? We're combining it with CTLA4. By combining it, we kind of keep the best of both worlds. That's kind of what we do. We keep a balance. We keep the inflammation really low and for a sustained period. We believe the same thing with GLP-1s. GLP-1s work again, nobody exactly knows how GLP-1s are having this effect in Alzheimer's, but there's a lot of good theories and a lot of good data as well. And they work in a slightly different way. And that's what we do. We say, look, can't two good things together, as long as they're not doing something crazy from a safety perspective, are going to be better than one good thing on its own. And that's kind of our whole premise at Coya, is how do we leverage those kinds of combinations? And it sounds simple, but you got to really think through what you can combine with what, right? It's kind of like a marriage. Not everything is compatible. And you got to put the right two things together and magic can happen. So that's exactly what we do at Coya. We create beautiful marriages of these different mechanisms with our Coya 301 as kind of as a backbone. And hopefully we're creating magic. Of course, we got to we've got to generate data. And I'm using like, high words here like magic, which of course biotech is not magic. We're a serious business where we got to prove, we got to show data, we've got to do the right things from a regulatory pathway. But I use that term more to express my enthusiasm and the possible potential for it. And I don't mean it in a minimizing way at all.
If anybody thinks that, I mean, you're definitely science driven, right?
Yeah, absolutely. 100. We let science drive our decisions, and we always have. And the exciting part is the science so far tells us it's working and the potential is pretty good. It has increased our confidence that our approach is likely to be successful across all these diseases, ALS, FTD, and potentially other diseases beyond that as well, which we haven't publicly disclosed yet. So yeah, the science is starting to line up, and we love it as kind of geeky people that the science is lining up, and there's nothing better than that. So
Yeah, absolutely. And you're attacking two, big ones, right? I mean, these are the big, terrible disease. Both of them actually. So underappreciated, underrecognized. But let me ask you this. So when the Nature magazine article came out and basically said they've done this million-person study and announced those findings, and you already expanded made the announcement that you were going to go into this, right? I mean, 1 million people is a lot of people. That's a pretty good study, you would think.
yeah. It's a retrospective study, so they look back at the data. But yeah, 1 million can't argue with 1 million.
Right, you can't argue with millions.
Yeah.
So has that percolated any interest from any potential partners?
That's the short answer is even before there was interest, right? When people realized we're doing this, when we had put out a press release that we filed intellectual property around the combination, it obviously intrigued a lot of potential partners. And then that scientific paper really kind of had external validation to it that then, of course, as you would expect, has amplified the interest. And we hope that the interest will be continued where we can hopefully get it to the finish line at some point and convert some of that interest to an actual strategic partnership would be my, something that we prioritize and we're pushing forward. And I'm hoping that maybe we can get something done, right? There's no guarantee on those fronts, but I would love to see a partnership that combines us with a bigger company, maybe a company that already has a GLP-1 that's successful, and advance it together with them. That's kind of our priority, or that's our strategy at least. But in the meantime, we'll also continue to generate additional data on our own just to keep strengthening that story in a preclinical model without really burning cash though. So that's the key. So we're hitting the right balance here. But the short answer to your question is, yeah, absolutely. I mean, that paper, I think, caught a lot of people's attention, and because of that, caught a lot of attention for us as well from some of these folks at the pharmaceutical industry. So
As a reminder, can you kind of give everybody the backdrop with you and Dr. Reddy?
Yeah, so we have a commercial partnership with Dr. Reddy's, who are a multinational company, 12, 13 billion market cap, depending on, I'm sure, the day. We gave them rights to commercialize ALS only, the indication ALS only with our Coya 302 in major global markets. That includes US, Europe, all of Asia. It basically excludes Japan, South America, and Mexico. So they have the rights to commercialize it. In return, we have up to the deal value is about 700 million. What it does is it sets up Coya nicely. We've already received over 10 million or so from upfront payments from them. We will receive another 8.4 million when we initiate the ALS clinical trial, which we anticipate doing later this year. So as long as we hit that milestone in 2025, we're going to get 8.4 million in a non-dilutive manner coming into us. In addition to that, there are additional milestones between that could hit in 2026, 2027, all before commercialization. That is up to 40 million. So we will hopefully be able to realize some of those milestones as well, which sets us up again nicely because we have a steady stream or steady line of sight to non-dilutive money, which, you know, I don't know the entire universe of biotech companies, but I have not really found a company that has that structure that is our market cap, where there's this line of sight to non-dilutive money. And then once the product is commercialized, Tim, we get mid-teen royalties. And ALS is a disease area where, you know, you could project 1 billion peak sales easily in the United States alone. And the last product that launched made 600 million in its very first year of launch in the US. So it's, you know, it's a number that has a real recent example from 2 years ago. So 1 billion, you know, mid-teen royalties. Once the product is commercialized, it puts Coya in kind of a self-sufficient mode, if you really think about it. And I think it becomes a very attractive prospect for people at that point. And then we have eligibility to get up to another 670 million on top of the royalty. So there's a lot of built-in non-dilutive money into the life cycle of Coya, which is very unique. And we've retained the rights to all the other indications. So we're free to partner those with other companies or take it on our own. And we'll make those decisions on whatever makes the most sense for us, our patients, and our shareholders, right? So we'll do what's right for people, but it gives us optionality. So we're thrilled to be where we are.
Which is a very unique position to be in for a biotech, because they're typically just cash burning machines.
Yeah.
I mean, that's the facts, right? I mean, you have a very unique model that I think is really underappreciated by the street.
I mean, you know, we have the ability to kind of top up our tank without going to the capital markets, which is not something that too many people easily have access to. So we are fortunate that way, definitely.
I don't know if it was fortunate. I think
I think it's a hard work.
Did you have a little something to do with structuring it that way?
I know. I think, yeah, of course, we all, the team and others deserve a lot of credit. And I think it's more importantly, it's a validation. It's a testament to the fact that we have a product that people see potential in, right? It's not just us saying, hey, we think this product has potential. We've had two different groups look at us and say that your approach has potential. One is Dr. Reddy's, that nothing, I always said, nothing proves that somebody truly believes in what they're saying than them writing a check. That's when you know they believe in your story. And the second is the Alzheimer Drug Discovery Foundation, such a high science, reputable group that looked at our approach and said they like it, and they invested $5 million in Coya. Right? That to me, one big company and another great leading preeminent foundation in the dementia space looks at our data, and these are highly science oriented people that look at it and say, look, I believe the potential similar to what Coya does. That's a great feeling for us, because then we know it's not just us drinking our Kool-Aid. There's people that have looked at it, kicked the tires, challenged us, and come to the same conclusion we did, which is you're onto something, and you're onto something good, and I want to be part of that, right? I mean, there's nothing better than that. Yeah.
And the backstory too on this, for those that don't know, that maybe haven't watched the other interviews that we've done here, but this is personal. This is personal for Howard. This is personal for you. I mean, it's everybody. it seems to me a lot of people have experienced one of these two diseases in some way through friends or family,
Yeah.
and know how absolutely horrendous these things are.
This is very personal to almost everybody at Coya. Uh, Howard's story, you know, his dad had dementia in his last days. Was very, I mean, I've never met Howard's dad. Unfortunately, I didn't get the chance to. But just from what Howard tells me, I can tell, you know, he was a wonderful person with a big impact on society and on Howard, obviously. So that's what caused, I mean, Howard to be passionate enough to found this company. And, you know, we have others, and we have our VP of Patient Advocacy is a wonderful person named Daniel Barvin, and I'm sharing this because I'm not breaking any medical confidentiality. He speaks about it in public. He carries the gene C9orf72 that puts him at risk for ALS and FTD. People who carry that gene have a very high probability, unfortunately, that they will develop the disease. So he's personally passionate about it. He has started a nonprofit called End the Legacy, which is ending the genetic ALS. So we have, and this is just, I'm only naming people who have publicly said stuff in our company, but there is so much motivation within this company to make this successful, not just because we want to be successful. Obviously, we want our shareholders to do well and all that, but we never forget who we're doing all this for. It's the patient, you know. And I always say, if you do what's right for the patient, everything else will follow. Shareholder value will follow, money will follow, success will follow. But you can never forget that our North Star is the patient. And it's not hard not to forget it when you're dealing with patients with ALS and dementia. You know, it's just front and center. It's just devastating what these families go through, not just the patient, right? It's all diseases affect the family, don't get me wrong, but these
This one is
neurodegenerative diseases have almost a disproportionate impact on the family members. And a lot of people, I don't think, realize the burden on the family members, on caregivers. So people have to sometimes quit their jobs to take care of their loved ones. It has a lot of society implications beyond just the patient. So, you know, any small part we can be of making a difference, that's what brings us all to work in Coya. I tell you, that's really what every single person in Coya is so motivated. I'm very lucky to have the kind of team that we have at Coya. It's a group of amazingly passionate, but extremely qualified people. So, you know, that's a combination that is usually a template for success. So we hope we're doing the right things. So,
yeah. I do too. I mean, this one is personal for me too. So I mean, it's
yeah, I know. Yeah.
horrible. And I mean, I look at what you just said about um, the responsibility. It's just like what you know. Basically, it's like having a grown baby. Is what winds up happening, right? You've got to take care of everything. But
Yeah.
but now it's not as easy as picking them up out of the crib. I mean, this is a grown man that you know my stepmother, who's barely weighs 90 pounds, is got to take care of like a baby, right? It's
No, it's tough. It's tough on people. It's definitely tough on.
yeah. Um, Let me just some housekeeping stuff. I mean, we did talk about the Dr. Reddy and line of sight, but how are you on cash and how many shares outstanding fully diluted right now?
We have approximately 16.5 million shares fully diluted.
Okay.
Um, Cash on October 31st, we reported we had 40 million in cash. So we haven't, since then, we haven't guided, but obviously it's first quarter earnings season, so we will soon be reporting those numbers at some point. But you can kind of extrapolate if we're at 40 million. We have guided it takes us into 2026 through some of the key milestones we talked about. And I want to remind you that we are eligible to receive 8.4 million later this year in a non-dilutive manner as well. So, it's what I was saying before about topping up the gas tank. Our burn has been about 4 million, 5 million, depending on the per quarter. So you can kind of see that, while we may burn some, we may also top it back up hopefully later this year. So.
So, and in the interim, as these things are happening, and there's always the chance of those potential partnerships being worked out, right?
I think that's exactly right, Tim. So I think there's two paths to value creation for Coya, right? One is we have a steady value creation that is happening right now, starting now, which is we're going to have additional Alzheimer's disease data. We already shared some. We're going to have data on the GLP1 combination with Coya 301. We're going to have the ALS trial, hopefully IND submitted and approved by the FDA and started. We have an investigator-initiated trial going on in frontotemporal dementia patients. We'll have top-line results from that sometime in the early part of second half. We should get 8.4 million from Dr. Reddy's, assuming that the IND is approved and we start the trial. So lots happening every month almost in 2025 that, I like to say is going to build steady value for Coya continuously. And then, as you mentioned, there are some intrinsic hockey stick moments built in to that valuation line because, we could have a business development partnership that's transformational. We could have things that we may get non-dilutive grants, other things that we can't guide to, but we're always pushing hard to make happen that could come to fruition. And if any of them come to fruition, then yeah, I think the one you kind of have some intrinsic value accelerators built in to the value creators. I guess that's the best way I could say it. Yeah. So.
Yeah. I think these are exciting times. I mean, this is, I know people are freaking out right now with things that are happening in the new administration, but I think ultimately, long term, all of these things will wind up being good things. I think we're kind of, we're cleaning some stuff up that needed to be cleaned up, and it's scary when you start doing stuff like this, shaking it up a little bit. But ultimately, I do think it will be for the benefit of the American people, right? I think quality of life is going to get better for everyone. I really do believe that. So, and if that's something that your company is 100% all about, is improving quality of life for people.
100%. And that's our philosophy at Coya. We're a small company. We focus on what we can control. What we can control is doing everything we can, do the right things to get these products through the next steps and hopefully to patients someday. That'll create value for society. I mean, that's nothing. There's going to be no better feeling that we did something that makes us as a country better, stronger. I still think the United States is the strongest biotech innovation engine. I can't speak to other industries, but I believe that for all other industries as well. But definitely, I mean, if you look at the innovation in biotech, I mean, I know I'm biased, but nobody beats us. Nobody really beats us. There isn't. We generate the most number of new intellectual property, if I'm right, in biotech. We generate the most number of new discoveries. There's a whole incentive system in place as well that many countries don't have. So
AI, is AI playing a role with you?
not at this current moment, but I think we're all going to have to keep an eye on AI and its role, because where AI, I think, can help companies like Coya in the future is as we are trying to prioritize and say, look, there's 20 other indications we can go to. How do we prioritize and decide where we want to go? I think there are AI systems that can help us do that more effectively than 10 of us sitting in a room for 10 days and trying to figure out what is better. I mean, some of this, I'm just starting to get familiar with how AI works in some things. I'm fascinated by it. I think the application is immense. being able to predict what combinations are likely to work better than others, for example, I think are areas where we could leverage AI. Today we haven't really used AI much to advance what we're doing at Coya.
But yeah, as I look at like quantum computers, I look at the AI, right? I think that we are going to experience some what people thought was going to take maybe could take years could take wind up taking months. I really think that the pace of which things happen is going to change dramatically.
Oh no, I'm amazed. I mean, I was with somebody who was using an AI tool for regulatory function, and I, for fun, asked that person to type in frontotemporal dementia into it. Within, and I'm not exaggerating, Tim, within microseconds, it summarized that one, there's no approved drugs for FTD, which I knew already, but the kind of trials that have happened, what does the FDA said before? Boom, like things that would have taken months to research and find out. You get a quick thing. And then, of course, to dive deeper, you're going to have to go read some of those things. But it was, I was pretty impressed. And it was just, you know, it's just one little example, but the kinds of things that people are able to do now. Look, if we as humans spent a lot of time gathering information, I think what AI is doing is taking that time out of it, right? That itself is a big win. Because if you really think about it, the process of gathering information in itself is creating no value. You're just spending 10 people are going to the library, pulling this, pulling that. That in itself creates no value. The value comes from what you do with the information, right? And I think, and you know, these are kind of simplistic examples that I have experienced personally, is that you can save a lot of time and resources in those kinds of, I don't want to say they're non-value added to go find information, but it's really the value in an information is what does the information tell me and how does it inform my next decision, right?
Right.
So the quicker I can get the information, I'm not wasting time on just the process of collecting it. You know, it's kind of, I almost feel like it's like farming. You know, you when we used to farm where we went and picked each thing,
Funny.
each corn by hand, and now the machines do it. It's the process of collecting corn is not value creating. It's the corn that's value creating, and so the quicker you can get it out, it's not bad, right? So
So
to me,
it's funny that you say that because as somebody that's an investor, I mean, spending time. I mean, I could spend time, a lot of time on an individual company, and then discover that, oh, this was a complete waste of time. And when I say time, I could spend months, you know, studying a company, and then for whatever reason have something come up that just kills the thesis for me, right? And that's time is the most valuable thing I have. I mean,
yeah,
that literally is the most valuable thing I have. It's the only thing that I spend that I can never get back, right?
exactly. Yeah,
And that is what makes the interviews, the companies that I do interview, is because I feel as though they are not just a want, they are a need, right? And
yeah.
and B, they are going to, if successful, have a very positive impact on humanity, right? So those are those things that make it worth it for me to continue to do what I do and spend the time that I spend, right? And then try to help, you disperse that information. And here's why this is important, right? This GLP-1 thing is really important, right? And I don't think people are understanding it, but this could have a huge impact on Koya, but more importantly on people's lives with potentially Alzheimer's, right? This is big stuff, man. This is like really, really, really exciting stuff, and it's not smoke. It's not a bunch of smoke. This is real. There's data behind it, right?
Yeah.
So that's what I get so excited about. That's what I love about the stock market, and it is the farming. I mean, it's a lot of farming, man. It's looking and pulling weeds.
Yeah,
That's a lot of pulling weeds, right?
yeah,
But
exactly.
there are some amazing companies, and I do believe that Coya is going to be one of those companies, right? That's what I feel. So
I appreciate you saying that, Tim. We obviously believe it, but it's always nice to hear others feel that way. There's, we don't kid ourselves. There's a lot of steps to go before we get to the promised land, um, but we feel bullish about it. We feel confident based on the science that we have a pretty good shot at it. That's
is
our dream. That's our dream. Our dream
it,
would be that we allow, for example, ALS patients as a starting point to live a normal life. If we're even a small part of patients achieving that dream, I think Koya would have fulfilled our promise, and that's what we're all pushing for. So.
where you are today, if it were just to go like through the normal processes, how long of a time frame is it between you actually where you actually have something that people could use? How long is that typically?
So the short answer is it depends on the data, it depends on the FDA, it depends on the European medical agencies, whichever country we're filing in. But I'll just use the FDA as an example. With ALS, there's precedence where the FDA has approved products based on one trial because it's ALS, the high unmet need. So assuming our data is good, now we'll have to wait and see that that's true. Uh, then there is a path forward, I believe, where the FDA can approve us on one trial, which means we're talking a couple of years before we are there. But if the FDA requires an additional trial, or which then it could be a little bit longer. But where we are right now, we feel like, based on the data we've seen with the investigator-initiated proof of concept study, where we stopped the progression of ALS, we feel pretty confident that the likely outcome of our clinical trial, the bigger clinical trial that we're planning, will be compelling enough that the regulatory authorities will take a positive view on it. So having said that, we obviously all this will depend on conversations with the FDA.
Right.
And to be fair to the FDA, they can't tell us whether that's a path or not until they actually see the data. They got to see, we are a
Right.
data-driven industry. But yeah, the path forward is there. That's what's exciting about it
And then
is.
there's the compassionate use stuff, right? I mean,
Correct.
if there's nothing, if it's an unmet or an unaddressed need, then I would think, or I would hope that the path would be fast.
Yes, I mean, there's definitely going to be a path for that. Again, we have to work with the FDA on setting what that compassionate use looks like. But yeah, it's something that would be obvious to explore for a product like ours that
Okay.
meets a need that is, that's so unmet. I mean,
Yeah.
so.
Arun, I thank you so much. I know you're a busy guy, but I thank you for coming in and updating us. When do you think we should maybe look to do a follow-up with you?
Sometime in early summer, or like June timeframe would be good, where I think we may have a lot more to say as well by then. So.
Okay. I love it, man. All
And
right.
obviously, I'm happy to talk to you at any time, Tim. So just let me know if so.
Yeah, absolutely. We will have you back. I'm going to be watching the news wire. I recommend to everybody that if you're not, so I had a CEO come on, and nobody's ever said this, but he said it, and it made me laugh. He said, all I'm saying is buy one share, one, right? And I thought that was clever because it's one share, right? His stock was like $1.50, right? Look, it's $1.50. Why not buy one share? And that way you follow the
Follow. Yeah,
story,
yeah,
right?
yeah, yeah.
Because you've got something invested, even if it is only one. And then that stock went to like $23, but that it's now at 11 or $12. And I thought, I'm not going to tell anybody what to do. I won't tell anybody to, you should invest in this. That's not what I do. What I do is I present the comprehensive story. This is who they are. This is the people leading the charge. This is right. Buy one share. I think I can feel comfortable saying that. Right? Buy one share.
Yeah, yeah.
And just so you keep it on your radar, because I think this is one of those ones that you would be disappointed if you were not participating at all, right? So I'm not saying go take out a second mortgage and go all in. I'm saying start paying attention to the story, go to their IR, sign up for their email alerts, and just see what happens. See as this story continues to develop. These are two big things that they're addressing, and if they can have even if it's limited success, it's still success, right? I mean, it's better than what's happening now. So that's, I guess, the thing that I would try to drive home. And we will have you back as soon as you have any kind of what you would consider meaningful data or whatever, right?
Happy to come back anytime, Tim. And as always, absolutely enjoy being on the show and talking to you. It's always a pleasure.
Okay, hold on one second. I'm going to shut this off. Hope you enjoyed today's interview with Arun Swaminathan from Coya Therapeutics. If you did enjoy today's video, do us a favor. Give us a like. How about giving us a share? And while you're at it, make sure you smash that subscribe button. All of those things are very important to us here at Alpha Wolf Capital, and we appreciate you taking the time to do that. Until next time, stay safe. Alpha Wolf Capital wishes you the very best of success.